We'll move forward now to Mark Lever, the Chief Executive Officer of the National Autistic Society.
Good afternoon, everyone. My name is Mark Lever, and I've been invited along really to represent the National Autistic Society, who are the UK's leading autism charity, and to comment on Asperger's syndrome generally, and not this case specifically. The National Autistic Society's position is that we do believe strongly that Gary's Asperger's syndrome should be taken into account in any decision relating to his extradition, and this hasn't been the case to date. And we're calling for urgent action to stop this extradition and allow him to stand trial in the UK. People with Asperger's syndrome can be particularly vulnerable because of the communication and social difficulties that they have, and Simon's refers to these. And they can also be prone to bullying and exclusion. They can also be susceptible to further mental health problems. And we believe that extradition to the US and the prospect of imprisonment there, potentially in the maximum security prison, would be inappropriate and damaging for anyone with Asperger's syndrome. I'd like just to make a couple of comments on the late diagnosis. This is something that the NAS has been campaigning for several years, and is the basis of some research that we've conducted over the last 2 years. Many adults with Asperger's syndrome, like Gary, are not diagnosed and are only now seeking a diagnosis. This is predominantly because the condition was relatively unknown when they were growing up. Often the diagnosis only comes about when the individual is in crisis or experiences some form of life-changing event. The diagnostic services for adults today are still very poor, and support for adults with autism in this country is sparse, to say the least. The National Autistic Society have been campaigning on these issues, and just to illustrate this with some statistics, we conducted a major piece of research into autism and Asperger's syndrome, adults with autism and Asperger's syndrome, under the I Exist banner, and we found that 60% of adults with autism found it hard to get a diagnosis, and 59% of adults, of those people, were only diagnosed in adulthood. So it is not uncommon to receive that diagnosis in adulthood. And over 60% of adults are just not getting the support that they need. Thank you.
Thank you very much.